thank you first for giving me the opportunity to talk to you about the work that the Institute has been doing. What have I been feeling about it? I've been with the subject of cancer and cancer control for the last 6 decades. It is very fulfilling at some points, sometimes very depressing, because we are not able to reach what you want in the time schedule that you have. There's always some kind of a obstacle. There's always something lacking which we are not able to make good. We feel, I think these things should not happen in a well-developed society. And I think journalists can help us a great deal in setting this right, because so many interviews, I've been giving interviews on cancer, on tobacco, on everything. Ultimately, it makes very little impact. The reason why I feel, this is my feeling, I may be wrong, is that it is done at a random time. You just do it on one day and then everything forgets. Nobody remembers it. There must be some continuity in whatever we are trying to do. Education has to be in a continuous mode, not today something and then afterwards forget about it and think of it about 6 months later. So if we talk of disease, again the disease we have to choose the audience for whom we are giving the interview. I think everybody will not be able to accept the type of language that one uses. So one has got to use a language, the communication has to depend upon whom you are addressing. So similar, difficulties have been there over. The most important difficulty that we have had, most important challenge that we have had to face is lack of education among the general public. Lack of education, and they are not interested in enhancing themselves. I think everything is taken as a today, yes, cancer, oh, cancer is, you only die. They don't think of whatever has happened, whatever new things have changed. We are not the same what we were in 1950 and today. Phenomenal changes have happened. We want to inculcate that change, and I think they must be part of the change. Unless they understand everything, how can they be part of the change? So this is the way. So cancer has not received the full support that it needs for us to control it on a national level. We have tried to do it in some way in Tamil Nadu, and there are a lot of efforts, but the population is so great, I think, and the area is so wide, and the type of population so different. To reach different people, we need different approaches. Cancer is a very, very unique disease. Very unique, very, very complex biologic phenomenon, as we call it. The causation, cancer is not a single disease. It is as many diseases as there are organs in the body. From the head to the foot. From the head, your eye, nose, mouth, lung, to the foot. As many organs. No two cancers are alike. And the causation and the way it presents is different in every cancer. So I will not be able to tell you what causes cancer. Today, the causation of cancer, we know in a limited number of cancers. The common cancers like cervical cancer, uterine cervix, breast cancer, oral cancer, that is oral is mouth and throat cancer. These are 3 cancers that constitute over 50% of all cancers in India. in India. We know the causation of these cancers. Not every one of them. Breast, we don't know the cause, but the head and neck and cervix, we are more than aware of the causation, and so we have measures even to prevent them. So no two cancers are alike. So to me, with the challenge of cancer, which is very difficult, we have to concentrate on cancers about which we know. We are able to know the causation, we can prevent them. Cancer can be prevented. And today, my slogan has to be, prevention is cure. Once you're able to, so if you want to prevent, you must know the causation, and then you will have to prevent them. So that is the thing. So breast cancer, we are not in a position to tell you what exactly it causes, but today there are a lot of research, genomic research, and there are certain genes that are involved with breast cancer, and we will be able to identify some of the people who are at risk. But that is not very easy because it's fairly expensive test and routinely done. But the most important is awareness. Our patients, our general public must be aware of the symptoms, early symptoms of cancer, and go to your doctor immediately. Once they go early cancer is curable. Okay, leukemia is a marrow cancer. It is a blood cancer, or all arise from the marrow. It is a blood cancer, arises from the marrow.
How it is come? How it is come?
Today, if I knew about it, I may get probably 10 Nobel Prizes. There are a lot of genetic predisposition. Extensive work is being done. Today, the focus is on genomic research, and a lot of things are being done. But as of today, nobody will be able to tell you what causes leukemia. In by chemical therapy, drug therapy, yes. Drugs have made a chemotherapy, as it is called, have made a phenomenal dent on the outlook for cancer, not only in blood cancer, but in many other cancers. It revolutionized concepts in cancer care, and cancers that are considered incurable have come within the scope of curability. Now, what you are talking is a change in the health scenario. Now, from communicable diseases, we are increasing non-communicable diseases. These non-communicable diseases are essentially based on lifestyle changes. What exactly do I mean by lifestyle changes? Your eating habit, the general habit that you practice, the abuses that you indulge in, the sexual life, the physical life, and many other wrong things. That is, so just the hygiene you practice. So let us say one by one. Hygiene you practice, or the hygiene can be personal hygiene, oral hygiene, sexual hygiene, multiple partners. All this definitely increases the causation, increases the propensity for cancer, the mouth cancer. And then habits. The very important are the habits, and in that tobacco is the worst. Tobacco habit, once tobacco is eradicated from the environment, I think nearly 40% of cancers can be eliminated. Mouth and throat cancer, lung cancer. Lung cancer, which was only the 5th or 6th in men in, say, in the 1980s, today is a top cancer. And basically, and then mouth and throat cancer. So tobacco is the worst killer. Tobacco in any form. Tobacco can be smoking, and the smoking can be cigarette, bidi, chutta. Then tobacco can be chewing. Tobacco can be smoke, can be snuffing. So different type of uses. Then it can be other things like gutka and so many other things that is being done to get over. So once we eradicate, and this eradication will be the prime object of cancer control. And towards that, I think media can do a great deal. I think this has got to be done on an everyday, daily basis in all the papers. In addition, to be put in the educational level, it must be a part of education. Health hazards, especially the serious hazards, diseases like cancer, must form part of health education and the causation. And the target audience, the target children will be the 10th and 11th standard children, where you have to inculcate the whole thing so that they don't start the habit. Now, these habits are not just habits, because once they start, it becomes very difficult to withdraw. So we must ensure that the children do not start the habit. That must start at the school level, and we need the support of the parent, of the teacher, and of the media. It is a very difficult disease to treat. That's all. One cannot say non-curable. That is too drastic a thing. It is a difficult disease. A lot of work is being done. I don't think I'm competent to answer in that, because a lot of new things are happening. Very difficult at the present moment.
Brain tumor.
There are certain tumors which are can be operated on, and there are chemotherapy, but basically they come within the area of difficult for management. Childhood cancers are related to are genetic in origin, and childhood cancers, fortunately, especially blood cancers, have come within the scope of curability. Especially certain types of blood cancers, we are able to cure almost 60 to 70%, and in the more developed countries they go up to 80 to 90%. And today marrow transplant has come in a major way, and where we are not able to do. Now only one thing that I would like to convey is that all these procedures, all these drugs are very expensive. Per child, it will cost you a few lakhs of rupees to cure them. The Cancer Institute provides free transplant, free drugs to all our underprivileged children. Not many people get it. If you take the whole of India, there will be lots and lots of children who are not able to get this. So it will be the responsibility of the government and the people and the profession to ensure that we give it to the child. So once a child is cured, their long-term longevity is very high. I think there is a great sense of satisfaction when you have a survivor. The number of survivors are increasing annually, and we have people who write their stories, who will tell you how happy they are. I think they have gone through a journey which really has given them a life, and I think it has been a sharing what should I say, between the family and the doctors, and they do feel, and we use these survivors to counsel the new people to get over their panic. I think that they are our ambassadors in taking cancer as a curable disease and not to panic about cancer.